The Arizona Department of Economic Security is committed to empowering Arizonans with developmental disabilities to lead happy, healthy, and self-directed lives with the help of services and supports provided by the Division of Developmental Disabilities, or DDD. As of October 1, 2019, eligible members qualify for physical and behavioral health services and long-term services and supports, or LTSS, contracted through DDD as part of the Arizona Long-Term Care System, or ALTEX. Long-term services and supports are Medicaid-funded services for people with disabilities and chronic conditions that assure optimal outcomes, such as independence, health, and quality of life. DDD is often identified as a provider of social services, but DDD is in fact a managed care organization contracted through the state's Medicaid system. What exactly does that mean? Let's find out. Let's start with the Arizona Long-Term Care System, or ALTEX. Simply put, ALTEX is the Arizona Medicaid program designed to help seniors and/or individuals with physical disabilities and those with developmental disabilities get the medical care, long-term care services, supports, and case management they need. The entity that administers Medicaid for Arizona is the Arizona Healthcare Cost Containment System, which is also known as ACCESS. Long-term care members make up less than 4% of the ACCESS population, but account for approximately 21.7% of the cost. One of the reasons long-term care accounts for higher costs is that qualifying members are eligible to receive long-term services and supports, which are often delivered in-home and community-based settings. In fact, for the 6th year, Arizona has ranked as the best-performing state for Medicaid services for individuals with intellectual and developmental disabilities, according to United Cerebral Palsy's Case for Inclusion. Elderly and physically disabled, or EPD, long-term care members receive services through ACCESS health plans. However, DDD members who qualify for long-term care receive services through DDD. That includes members who are eligible for both Medicare and Medicaid. DDD is unique because it is a hybrid division of a government agency. That means we're contracted as a managed care organization, or MCO, a regulator of other MCOs, and a direct services provider, meaning we contract with and pay qualified vendors and contractors directly. DDD is closely connected to ACCESS. A contract between ACCESS and DES/DDD provides the framework for DDD's roles and responsibilities as a managed care organization, a direct provider of LTSS, and as a regulator responsible for the monitoring of its contracted DDD health plans, also referred to as MCOs. Under DDD's contract with ACCESS, DDD provides long-term services and supports, or LTSS, similar to how the health plans have requirements to provide physical and behavioral health services. This is where our role as a managed care organization really kicks in. DDD as a managed care organization must follow contract requirements set out by ACCESS and the managed care rules. However, there are differences between the services provided by the DDD health plans and long-term services and supports DDD provides directly. That's interesting. Yes, physical and behavioral health care along with long-term care represent the continuum of care. Physical health care is medical care that treats physical conditions, from the common cold to a heart attack. Treatment is usually provided by a doctor in an office or a hospital. Behavioral health care treats mental health conditions and substance use disorders. Behavioral health care can be provided on a spectrum, with a range in treatment intensity and duration based upon a person's needs. Long-term care, on the other hand, includes skilled, therapeutic, and direct care services and supports that may be needed by a person whose physical and/or mental condition limits their ability to function independently. DDD delivers long-term services and supports through its qualified vendors. Except for our state-operated facilities, which we will cover in a minute, these qualified vendors, or QVs, provide a wide array of services and in some instances are authorized to provide more than one type of service. QVs provide services including habilitation, attendant care, and respite. QVs may also provide other services including day treatment, training, and group homes. Additionally, DDD oversees state-operated facilities. Currently, we have 15 state-operated group homes and 11 intermediate care facilities. Hopefully, you have a better understanding of DDD's role in delivering healthcare services to qualified individuals, how it functions, and how it follows the specific rules of a managed care organization in Arizona's healthcare system. Learn more at des.az.gov. Thank you for watching.